Today we'll be looking into one of the risk factors for families who present to our service, and that being the substance misuse. There are 8 slides all up, and we'll begin with defining 3 different types of risks. New South Wales Department of Community Services provides its definition of risk factor, and that it means a measurable characteristic in a group of individuals or their situation that's associated with a negative outcome. So example of a risk factor would be a low socio-economic status or a parental substance misuse. The next definition is cumulative risk, multiple occurrences of the same risk factor and or the accumulating effects of ongoing adversity. For example, inadequate nutrition due to poverty would be a cumulative risk. The last definition is proximal risk, and this is defined as risk factors experienced directly by an individual. An example would be of that would be domestic violence, witnessing domestic violence. Slide 2 is regarding substance misuse, is on impacts on parenting. So families who present to our service are experiencing substance misuse. As Bromfield points out in the Victorian Government Department of Human Services, that could be considered as having multiple and complex needs. So one of the impacts of substance misuse to be aware of is its impact on parenting. Those who are currently who have children may have had parents who are misusing substances, and this has had an impact on the parent as well as the child in areas of physical and mental health. It may expose both parents and or the child to family violence and possibly reignite trauma or create depression, anger or disassociation. This can lead to the ongoing cycle of substance use and misuse. Slide 3, the Australian Institute of Family Studies shows differences in 2 types of causes as to why a person may be misusing or abusing substances. Those being from either family or the way they were parented, or even as parents themselves. They may have had parents who've suffered from substance abuse or had criminal behaviour. Also being exposed to stress may be another factor. The environmental causes associated with substance misuse are socio-economic disadvantage. So poorer neighbourhoods, their parents may not have worked and may even be generational unemployment. Stresses from housing, such as financial responsibilities associated with it, and even the neighbourhood they live in may be a disadvantage to them, such as the 10 top poorer postcodes in the state. Slide 4. Substance misuse under child maltreatment. The definitions for this. The Australian Institute of Family Studies provides further understanding into what risk factors, protective factors and child abuse and neglect look like. So they define risk factors for child maltreatment as measurable circumstances, conditions or events that increase the probability of a family having poorer outcomes down the track. The protective factors are defined as those things that contribute to healthy development and child well-being on an individual, family, community or societal level with moderate risk adversity. Things such as a positively influential grandparent or community activities that increase self-esteem also come under that definition. So child abuse and neglect, they define as any acts committed or omitted by a parent, caregiver, other adult that causes harm potentially or actually to a child who's 0 to 18 years, and that's even if it's unintentional. Slide number 5, the Department of Human Services in Victoria looks into the importance of the relationship connection between practitioner, family, including extended family as well. Communicating clearly and respectfully helps to facilitate engagement despite possible circumstances of substance misuse, trauma and stress. Role clarity is important to having a thorough understanding of what your role is and its limits. So being clear on things such as organisational procedure, legal frameworks and local resources that can help the family. Another important thing in the practitioner-family relationship is specifying goals that can be empowering and helping the family have ownership of working towards their longer-term vision. Ensure that the goals are tied to concerns that have been identified. So in summation, it's the practitioner's role to provide the widest possible assistance. Slide 6. Covers risk versus protective factors. So when considering substance misuse, it's useful to look at the potential risks versus protective factors. New South Wales Centre for Parenting and Research states that services and interventions have the potential to be effective for all. So looking at the risk versus a protective factor shows where in childhood disability is considered a risk, then social skills would be a combative protective factor. Risk factors in family would be a poor supervision, for example, and its protective factor might be supportive parents or a caring adult. Risk factor in schools may be a negative peer group, and the factor protecting against this would have the child or the youth feeling a sense of belonging in a positive way. Risks in the context of community may be where an individual is experiencing a lack of support, and its protective factor would be having them involved in community networking of some kind. So protective factors could be viewed also as preventative intervention when applied to the issue of substance misuse. Slide 7. The Victorian Government has a definition of what multiple and complex needs are for families inside their best practice case practice model. The breadth of need is to do with multiple needs that are interrelated or connected. Depth of need is related to profound, severe, serious or intense needs. What's important to consider is that families presenting with possible substance abuse or misuse usually have numerous problems going on in their life, and this is the basic framework for building understanding and response as a practitioner. So instead of characterising somebody as complex, it's more helpful to define them as having problems that are multiple or complex in relation to their social health or economic aspects of their life. And the final slide is child development under prevention and early intervention, among other points. So the Australian Research Alliance for Children and Youth state that understanding the ecological model of child development and the risk factors can help improve child outcomes through prevention or early intervention. Childhood development is complex, but there's what they call a window of opportunity for guidance in a positive direction. Home environments, play and parents are all critical to how a child develops, along with their health and well-being. Adolescents also have a window of influence where they are exposed to peer groups outside of family. There's no set winning formulas, however, prevention and early intervention, through understanding what can lead to substance misuse and how to combat that can be a positive influence in assisting those families that present to our service. And slide 9 is the references.